Hello again, everybody. Dr. Glenn here with Infinite Wellness. Another video coming to you again today. Last of our year. It's almost the end of 2025. And this might be a great video to kind of give you guys some knowledge, a little bit of something about certain body parts, stepping outside of just the spine for chiropractors. Many of us actually do work on other joints of the body as well. So today's video will be about some of that. And please like our videos. Please subscribe to our channel. We've had great growth. We want to keep going. And we'd love more questions. So the more questions you guys ask, the more I can answer.
All right, so today it says, can chiropractic care help with knee pain? And what exercises, if any, would you recommend?
Excellent. Great question. Can chiropractic help with knee pain? Absolutely. Any joint can benefit from looking at its structure, looking at its function, how it moves, whether it can move, whether it can't, and what kind of things may be going on with it. Now, of course, with knees, we're going to get, like a spine, we're going to get lots of different advanced phases, so to speak, of degenerative changes. Knees wear down as we age. There's no question about it. They're a weight-bearing joint. They bear weight on the lower part of the body. They have to carry us around. So many of us throughout life will experience some type of knee pain, either from an injury, most of the time, and or just from, as we get older, degenerative changes that occur in the knee with just weight differences or issues with the spine or pelvis, hips themselves. Oftentimes, if we walk for years, even with a imbalance in our hips, then the knees wear unevenly. So just like a car that's not had an alignment, front end alignment, and has hit something or has issues with a hard stop or something else, if we don't keep that alignment, then the tires are going to wear slightly differently from side to side. One will wear out faster. Knees are very similar, as are ankles and feet. Where does chiropractic come into all of that? That's another excellent thing. What do chiropractors have to do with knees? Well, again, like I said, we're going to assess you from pretty much top to bottom. We're going to look at your feet. We're going to look at your ankles. We're going to look at the knee joint itself, hopefully, like I said, with structure and what its capabilities might be. And then we're going to look above it to the line of the pelvis and the lower back to make sure that that stability all wears evenly into the knee. If the knee has had changes or is not moving appropriately, there are minor adjustments that can be done to the knee, just like the spine, to get it back into a proper position. There are lots of exercises. Really, with knees, it comes down to, what can I still do? What do I need to do? So if your desire is nothing more than to be able to even just walk around, then we need to look at the knee from that perspective. If you want to be able to get on and off your own toilet, if you want to be able to squat down and stand back up and not need devices or bars or furniture, most of us use that. What we're looking to do is make sure that the knee can move comfortably through whatever range of motion we still feel like we need at whatever point in life we're in. Now, if you're bound to a wheelchair, you don't need your knees too much. Hopefully you're not there. Hopefully we're getting you this video before that. We'd like to be able to fix your knees before they limit you and they're the reason you're in a chair. But lots of things can come into play there. The main thing especially is to get us properly aligned, moving properly, and then deal with both flexibility and stability of the knee. And all that will come down to rehabilitative movements. I call them exercises because technically they are, but really they're just plain movements. Some need resistance, weight, force. Others just require capability to do with your own body weight. And we're going to show you some of those. So we'll get into a little bit of the exercises that are imperative to the knee. I won't get into too much on how to adjust the knee or what things can be adjusted in a knee. That's something that love to have you come by if you're having knee problems. Come in, we'll evaluate it, and we'll talk about all that. That might take a little while, and it'll be specific and individual to you. But most exercises are fairly generic, and we're going to teach you how to do many of them. All right, so exercise number one. This first exercise focuses predominantly on training movement of the quadriceps femoris, the front of the legs, and this is done predominantly to help with tracking of the kneecap. Okay, so if you've got severe meniscus damage or some other things, or lots of scar tissue in the knee, whether it's from injury or post-surgical, this isn't necessarily the fix for that. But for problems below, pain below the kneecap, difficulty bending the knee, difficulty kneeling down, this exercise is fantastic for those kinds of things. And what we're doing, like I said, is looking to strengthen the quadriceps. This can be done with both legs if you've got capability to do this, or with just one at a time. Either way is going to be effective. So we're looking for just plain old leg extension. We'll sit upright and we'll just lift all the way up until the knee locks with the foot. You can do this individually with each leg. You can do this with both legs. If you have bands for resistance, or if you go to the gym and you've seen a leg extension where you sit into this, lean back, and there's a pad at the ankles that you can set the weight with, that's the exercise we're talking about. Anything that creates resistance will help you. There are ways to do this, and we won't get into this too drastically. You may have to come to the office for this, but you can cheat and turn the foot outward to focus on the medial inner side quad. You can turn the foot inward so that you're lifting this way and using the outer part of the quad. And a lot of that will be determined by where your kneecap sits. Somebody needs to evaluate that for you and show you which one of those directions is most beneficial for you, and that comes with an eval. But yeah, lots of leg extension will help predominantly with kneecaps, at least for pain with pressure into them and or movement with them. The next one will focus on a little bit more about the structures around the kneecaps. So really more that damage and pain to meniscuses or even the internal ligaments. Again, whether just injury or post-surgical. And exercise number 2. We talked a minute ago, the other exercise, about leg extension. We're extending the knee or bringing it from a bent position to a straightened position. Now we're going to talk the opposite direction. Now we're going to talk more about flexion of the knee. The knee should flex, so much so that the foot actually touches the glutes. So it should be full flexion. That's the idea. And this is the motion that probably 75% of my patient load and most of the country struggles with. Most of us don't struggle with extension, even though we have the knee pain. We struggle with flexion. And oftentimes that's due to damage, like I said, to the meniscuses or the ligaments internal. And there are several. Big anatomy lesson. Anyway, what we want to do is make sure that the meniscus and those ligaments on the internal portion of this, including the patellar ligament from patella to shin, all are flexible enough. And to make them flexible, we have to flex them. Literally, the term flexibility comes from flexion. And flexion of the knee is extremely important. Most of us have a hard time. 90 degrees is about the majority of what most of us can flex. So starting from 90 is okay. And there's nothing wrong with just starting here at 90 degrees, learning to scoot yourself out to the edge of your chair. You're going to place your feet in front of you so that your knees are behind your toes. You're going to learn to lean the body forward, putting our weight above our knees. We are going to push forward and stand up. These are known as chair squats. Full squats will come in later. This is a great beginning. Very simple exercise to start, just standing up from a chair. Originally, you're going to be tempted to do all the stuff we see people doing, right? Leaning into the arms of the chair, grabbing other furniture. I want you to learn to do this just by using your body weight, leaning forward and standing, and then controlling it and sitting right back down. We want to be able to get on and off our own toilet until we're 95 years old. This is how we do it. Now, is that enough for flexion of the knee or to get rid of the knee pain? No. That is a great exercise to judge how well our knee pain is doing in a squatting motion against our body weight. But to actually loosen up those ligaments we were talking about in the meniscus, we have to learn to increase the depth of the squat. We have to flex more than this 90 degrees or so from a chair side. So we're still going to use our chair, and now we are going to get to support ourselves. We're going to place our hands on the edge of a chair. Make sure this is a very sturdy chair when you do this so that you don't fall. We want to be able to hold on to this and know that it's going to support our structure. We're going to bring our feet back out, like I said, only even a little bit further this time, so that our knees are all the way back directly above our ankles. We're doing that because we want to learn to be able to sit deeper, and we're going to use the chair as a brace. So, great exercise for this is flexion of the knee controlled through supporting oneself with their arms or their hands. And we're going to slide gently off the end of the chair, just allowing our glutes to slide down the edge, keeping our hands intact, trying to get lower. And then when we get down here, pushing with the legs, if possible, as much as you can, using the arms only as a guide, and getting back in the chair. These help us deepen that squat. We're able to go lower than we think we can. And we can get down in here and move around, start learning to use those structures of the knee, including the meniscus, to balance and support us down there. The reason we do that is ideally to get to the next phase of this exercise. Now, this is one I don't recommend for your beginners. Start there. That's enough. Do that for a while. Eventually, our goal is to be able to do that and come off of that chair, not needing it anymore, and still stand up, which would look more like this. You're going to lower yourself into that position. You're going to free your hands and then stand. You can hear my knees. They make lots of noise. I don't know if that came through on the video. Hopefully so. So those noises are normal, okay? It's all right that they do that. They should not be severely painful. Mine were a little tender when they did that, but pain's gone pretty immediately because I'm teaching my body to squat that deep. Will your knees complain in the beginning? Absolutely. A lot of things that we do take a little effort, a little work. Sometimes our body complains in the beginning, but we will get past that. So once you've gotten beyond that, that will become a much easier exercise. The more of these I do, the easier it gets for me and the less noise we hear. There's still a little. If I do enough of these, that will be gone and I will be fine.